Hello guys, welcome to Pajan Imaging Hub. In today's patient and public education series, we'll look at radiation risks from medical practice, that is from radiology. How risky is it? Why do we need to still undergo the radiology test, even when it is risky? Please don't forget to subscribe to this channel so that you'll be notified when new video is released. Thank you. Welcome back. We'll look at the topic using the following outline. What is the radiation risk in diagnostic radiology exams? Type of radiation risk, stroke effect, how radiation causes harm to the body. Then relating the radiation risk to tangible measures so that we can have something tangible to be able to hold on to say this is how this is what test we did can be compared to, and this is the amount of radiation we receive for a test that we did, and this is the risk level of this test that we've done. Then relating the radiation risk to this tangible level, then why do we need to continue some radiology exam even when they are risky? Then there are safeguards employed to reduce or prevent radiation risk. Then we'll look at advice to patient and public. I have some advice to patient and public. I would like to emphasize, if you watch the previous video I did on Welcome to Radiology, I stated that there will have section radiotherapy section of radiology and diagnostic radiology. In radiotherapy section, they make use of very high radiation dose to treat cancer. The high radiation dose is used to kill cancer cells. But in diagnostic radiology, we use some of the machines emit radiation. But the aim is to make diagnosis of conditions. And the radiation dose we use there is not to kill any cancer cells or any anomaly in the body. It is to help us to make diagnosis. And it is that aspect, the diagnostic radiology, that this lecture will cover, to know how safe it is and why we should continue to do the radiology exams in diagnostic radiology. What is the radiation risk in diagnostic radiology exams? Some of the diagnostic radiology equipment, of course, I've said, uses radiation, like the X-ray machine, the fluoroscopy, mammography, OPG, CT scan. So these are some of the equipment that uses radiation in diagnostic radiology. So there is tendency of having effect, negative effect, harmful effect from this machine due to the radiation that they use. Now, this radiation is harmful, of course, to the body. It is also said to be cumulative, meaning that if you receive some dose today and tomorrow receive some, next tomorrow receive some, all of them are going to add up in the body. Now, let's look at this effect or harm or risk that radiation can cause to the body. There are basically two models that is used to explain this risk or effect that radiation can cause to the body. The first one is deterministic effect or model, and the second one is stochastic effect or model. In deterministic effect, there is a threshold which must be reached before an effect can occur. That is, a negative effect or harmful effect of radiation can occur. There must be a quantity of radiation you must have received before you have such effect. And this effect increases in severity as the dose increases, and they also increases in the effect has a higher chance of occurring as the amount of those also increases. Now, below this threshold, this model says that there is no effect, negative effect or harmful effect of radiation that can occur. This model, the emphasis is that the threshold must be reached before an effect can occur. There must be a dose range that must be reached before an effect can occur. Now, the second model is stochastic effect or stochastic model or stochastic risk, whichever way you want to call it. This model states that there is no threshold that must be reached before an effect can occur, that there is no dose of radiation that is safe, but the effect increases as the dosage increases, and it is not if the severity is not dependent on dosage. Remember, the first model, the deterministic model, says that the severity of effect we're going to have depends or increases with dosage, but this stochastic model says that the severity of the effect is independent of the dosage. In other words, little dose can still cause you a problem that will have high severity, and high dose can equally cause the same thing. But the two models agreed that the probability of occurrence of effect increases with dose. The higher the dose, the more likelihood or the more assurance that effect will occur. A deterministic effect can be predictable. Once you reach the threshold, you can predict some effect that can occur. But stochastic effect is not predictable. We don't know the effect that will occur. But just as I've stated, the higher the dose, the more assurance or probability of having this effect. So let's look at this graph that shows that. So you see here is the threshold that must be reached before any incidents can occur. But here, there is no threshold. However, most of the research done, the data is on a high dose. There have not been appreciable data on effect of radiation on low dose. So you see, this one is extrapolated. There is no data on this section that shows incidence, but there is no data at the same time that shows no incidence. And this is the preferred model, because this have not been able to prove that here is safe. The only thing that there is no data available that is significant to show that here is safe. Okay, having looked at these two models, let's look at how radiation causes harm to the body. Radiation causes harm to the body by tissue damage through changes in chemical properties of molecules in the tissue. Most cases through release of free radicals from the molecule, especially the hydroxyl radical from water. You know, the body contains a good quantity of water, about 60 to 70%. Once the body is exposed to radiation, the mechanism is to cause ionization, and when an ionization of molecule occur, a radical is released, and you know the effect of radicals is a oxidizing agent. It destroys whatever it sees. So what does this radical that is being released from the body cause? Now, this radical can cause cell death, and when the cell dies, the function the cell is supposed to play will be affected, and the person will become sick. If there is a significant amount of cell dies in the body, the person can die. And cell can be damaged. That is the second effect. Cells can be damaged, but they'll be repaired back normal. In such a case, there is no problem. The body still have a mechanism of repairing or taking care of radicals that are being released in the body. So in such a case, if they're able to curtail the radicals and repair the damage they have occurred, the body have no problem. It recovers. There is a third effect. Cells are damaged but repaired erroneously. So this gives rise to disease due to malfunctioning. Because when the cells are not working well, the function they do will not be done well, and that will lead to anomaly or disease. Now, the fourth effect is that the cells are damaged, they are erroneously repaired, but they give rise to hereditary changes. If they occur in the reproductive sex, which is used to procreate, it can be transferred into the next generation, and that will affect the offspring. It may not manifest in the parent, but to now manifest in their children. Those malfunctioning of the cells or functions will now manifest in the children because the sex that is used to produce the sperm and the egg probably were deformed or damaged and repaired erroneously. So they will now migrate to the offspring and manifest in that generation. So, having known this, let's now look at the medical test. How can we be sure? We have looked at the models. The model that state that there must be a certain dose you must receive before you can think of anything happening to you. The other one said there is no dose. That means there is no medical test that is safe. But then, let's have a look at see how we can handle this. Why we still need to be doing these investigations, and what are these tests that we do? What is the risk percentage? Now, relating radiation risk to tangible measure. For example, erythema, if you, can occur with a dose of 2 gray to 15 gray. If a patient is exposed to 2 gray to 15 gray, they can have erythema. Cataracts can occur when a patient is exposed to 0.5 gray to 2.5 gray. The sterility or infertility can occur if a patient, a gonad, is exposed to 0.15 to 10 gray. But then, how many doses do we get from the common X-rays that we do in radiology to know when we're in danger? Now, chest X-ray will give you 0.1 milligray. CT scan is the machine that gives the highest radiation dose in diagnostic radiology. It will give you from 1 to 10 milligray depending on the type of CT scan you do. But how does this help us? Let's take sterility and infertility for example. The patient needs to be exposed to 0.15 gray to 10 gray to be for possibility of this to occur. Now, chest X-ray. If we take chest X-ray, remember the place that is being exposed is where the radiation is absorbed, but there are scatter or cause scatter that will extend to other part of the body that is not the direct place that is being exposed. So if we do chest X-ray for example, the research shows that about 0.09 may get to the gonad or milligray will get to the gonad. Now, abdominal CT, for example, if you do abdominal CT, where even the testis is part of what is being exposed, the testis may, that is male gonad, may absorb about 2.4 milligray. Now, let's do small calculation. We're looking at when the patient needs to be exposed to 0.15 to 10 gray before he can have possibility of develop or becoming sterile or infertile. Now, this patient, if we are to go by the concept that radiation is cumulative, then this patient needs to be exposed to 1,666 chest X-ray to 111,111 chest X-ray. This patient needs to do this number of chest X-ray before there is possibility of this. Then if it is CT, this person needs to do 62 CT to 166 abdominal CT before there could be possibility of this radiation of this condition. Now, you and I know that even if you had to come this world 5 times, you cannot undergo, or you cannot be allowed to undergo 1666 to 111 to 111,111 chest x-ray, or 62 to 166 abdominal CT. There cannot be a condition that will make somebody to undergo such number of CT scans or chest x-ray. But we still have that problem of the second model, which is the stochastic effect. For the deterministic effect, we have been assured that in diagnostic radiology, we are not being exposed to even close to such range or threshold of having those effects. But in but the second model, which is stochastic effect, say that dose is not important, that any amount of dose can cause an effect. Stochastic effect has two major effects that can occur. That is genetic effect, I've explained that, and cancer induction. These are the two major fear. And this effect does not occur immediately. There is a latency period, and some of the latency period is too long. You can imagine where the effect need to be followed. The possibility of the effect occurring need to be followed to the next generation. So these are the fear we have in diagnostic radiology. So what do we do? Why do we need to continue some radiology exam even when risky? There is the risk of not doing the investigation. Radiology department is an important department. It offers a great value, is a great asset to in medical practice because it plays a vital role. Diagnostic radiology makes visualization of internal organs and structures possible. Similar thing is possible to some minor extent, like the use of scope, like in endoscopy, colonoscopy, bronchoscopy, to visualize the gastrointestinal structure or the trachea and bronchus. But it has a limitation, and it can only visualize to some extent. And the patient needs to be under anesthesia in most of the cases, and anesthesia has effect to the body. But in radiology, we don't make use of anesthetic agents, except in some few cases, like in interventional radiology, where we may use a local anesthetic agent. So this value of radiology to medicine is difficult to overlook because of the effect of the because of a possible effect of radiation. So it offers a lot of value. Many diagnoses are made easily. The issue of stroke and intracerebral hemorrhage is easy to make that diagnosis. Once you do a CT scan, you see the inside of the brain. There is no scope that can show us the inside of the brain as that. Tissues, organs in the body. Once you do a CT scan, it gives you a cross-sectional imaging of all these body parts. You can visualize the inside of the body clearly. So the risk of not doing the investigation is a problem. So missing the diagnosis is one of the issues. Radiology offers a lot of values. So if you don't, most of the disease conditions can only be accurately diagnosed in radiology. And when you now compare, now making this accurate diagnosis because of the risk of radiation, the patient may die. And the second one is initiating treatment too late to improve the medical outcome. If the decisions are not made or what is the diagnosis on time because of fear of radiation, the patient may not get the adequate treatment. We may still lose the patient because of fear of radiation, that we are not that accurately sure of how it will occur, because stochastic effect is random effect, is a probability effect. We'll still look at other reasons why we still need to continue the radiology practice. In case this reason is not enough, we'll have other inevitable risks that we do undertake in life. We do those things even when they are risky because of what we gain or because we don't have choice. The first one is background radiation. Background radiation is the radiation we receive by just living in our place or going about in our environment. The cosmic ray, the radium gas, and all that. And it varies from location to location. But we still live, and this radiation still find us. It has been calculated that, for example, chest X-ray, which give 0.1 millisievert or 1 milligray, 0.1 milligray, is equivalent to 10 days background radiation. So without doing chest X-ray, just by staying in your house or anywhere you go, 10 days it will appear like you've done chest X-ray. You have received equivalent dose of what you would have received if you had done chest X-ray. Then mammogram, it gives 0.4 milligray. Is equivalent to 7 weeks of natural background radiation. So whether you do mammogram or not, by 7 weeks is expected that you have received equivalent dose that you would have received if you had done mammogram. Then CT scan, for example, give a 1 to 10 millisievert or milligray is equivalent of 8 months to 2.5 years of natural background radiation. This data is a US obtained from US population. Different regions have a different level of background radiation. Then the other one is occupational hazard. We have like people in the medical field during the time of COVID. It was hell. Many people lost their life because their work made them easy to contact, to come close to the patient of such disease condition. And there are many other disease conditions that coming close is an issue. Then we'll have drivers that drive vehicles. The tendency of them having accident. We'll have the air force, the military that fight armed robbers and terrorists all the day. They can die. They still enroll into military, even when they know there's likelihood of war breaking out or being sent to war zones and they may lose their life. These are risks. Then there are human activities that we do. Swimming, somebody can get drowned. Even driving, somebody can have accident. Even walking on the road, somebody can be hit by even a stray bullet. These hazard, these are activities we do that are equally risky, but we still do them because of what we have to do them or because of the joy or value we get from them. So with this kind of context also, somebody that is afraid of this risk of radiation should equally think along this line to find a justification to do the exam. Let's look at even this so-called cancer issue that used to frighten people when you talk about radiation. They say radiation can give you cancer, and you get afraid. What is this cancer risk? Let's look at without radiation. What is the cancer risk? Natural incidence of cancer is 1 chance in 5. That means in every 5 individual, one has a possibility of developing cancer in his lifetime. This is equally equivalent to 400 chances in 2000. This is gotten from US population. Let's look at the machine that give highest radiation dose in diagnostic radiology. A CT scan examination with an effective dose, absorbed dose of 10 milligray or millisievert may be associated with an increase in the possibility of fetal cancer of approximately 1 chance in 2000. Now, people that do CT scan, they have 1 chance in 2000 of developing cancer. So if you add this 1 chance to the already known 1 chance in 5, that will give us already known 400 chances in 2000. That would give us 401 chances in 2000. So the effect, even though there is nothing like small in a possibility of cancer, because just as we said, it can occur in any dose and you never know. Although we know that the randomness or the probability increases with increased dose, but looking at it, the what it added to the cancer risk is not that much compared to what cancer risk is without radiation from medical use. But with all these, still, we'll have safeguards we employ in preventing or reducing radiation risk in radiology department. We'll make use of concept of justification and optimization. And how do I apply this principle of justification and optimization? The first thing we do is that non-radiation test is considered before radiation test. It is only when there is no available non-radiation test that can give us what we want that the clinician requests for radiation test. Then some of the test, radiation test, give lesser dose compared to some. Some give higher dose. Like I've stated, CT scan give a higher dose of radiation, but CT scan also give a higher value in some cases. But we'll consider the lesser one, the one that give lesser radiation, before we consider the one that give higher radiation. It is when we find out or we know that the one that give lesser radiation cannot give us the what we want, that we go for the higher one. They will make use of reference dose. Reference dose is just like average data that have been obtained in all the tests we do. What is normal, that is enough of radiation, that is just enough to get us a good image that we can use. So this average is being calculated in regions, can have their own, a country can have their own. So they make use of it in choosing radiation level or dose to use for any investigation. So it's not when you go there, the person operating can choose any radiation he wants. There are already a certain level of radiation that they must use, which they know that with this, it is enough just to get what we want. Then we equally apply those limitation device and techniques. This place that is radiation is being exposed, the part of the body radiation is being exposed, is where we are interested in. So the other part, that radiation that we are not interested, we can actually shield it from being affected or from radiation reaching those areas. So that will make use of what we call those limiting devices to shield those areas and make sure that the radiation is concentrated only to the area that needs to be seen. These are what radiographer studies, is part of what they study, so they know how to do that. So you shouldn't bother yourself much on that. It is their work. An adequate timing of an exam also. They apply this, like most cases where for childbearing age patient, when they come and they are not sure of what their pregnancy status, will consider to do the exams within their first 10 days of their menstrual cycle, so that with that time we are sure that there is no, or there is a very, very minimal chance of pregnancy. The other thing we do as part of the safeguard is staff certification and training. We make sure the staff have the radiographers are well trained, and it's only when they are satisfied, have finished their schooling, that they can dispense radiation. I have some advice to patient and public. One is that they need to understand that radiation exposure depends on the type of test done, the area of the body exposed, the person body size, the age, sex, and other factors. And all patients are not exposed to the same level of radiation. And most cases, these are taken into consideration in attending to them. Then they need to discuss with their clinicians the importance of any X-ray request, the cost implication of replacing or removing this test, you need to ask whether there is safer test which may probably be costly or not available or easily accessible. There are some I mentioned like magnetic resonance that can give some of the required image that we need in some condition, but they are not easily available. But there are some places. Some people that have the money can go and get those exams done instead of probably repeating or doing multiple CT scans. Then some cases can be done. There will have ultrasound, so they can ask whether ultrasound can use this kind of thing result. So the last advice I have is ask your imaging specialist how they can reduce the amount of radiation used and how your cooperation could help them. Also, if there is a safer test. Most cases, the doctor does not know that there are safer tests they can use to find the condition they want to rule out or verify. So the imaging specialist or the radiologist or radiographer can help out in those cases. In such cases, when there is a modification, in most cases they may refer you back to the doctor to confirm their modification. But there are some also levels that they can equally overrule some of the requests and do the right thing. Then your cooperation in the radiology department is very, very important. Ask them what can you do to make sure that they get this test at least once, how you can cooperate. In most cases, they may not get it once. At times because the patient does not cooperate or at times the machine fails. So there are some cases they may need to do some of this investigation more than even 2 times. Thank you. Please like, share, and subscribe to this YouTube channel so that you can receive new videos when they are released. Bye for now.